I'm Dr. David Warwick of Warwick Chiropractic. We have Ty here, and Ty is an MMA fighter, and he enjoys it, but it's more of a discipline for him. He had shared with me, and he was experiencing some hip pain, and I want to share with you that a lot of times when you're having pain in the hip, the knee, the foot, shoulder, elbow, or hand, a lot of times it originates from the spine. So as a chiropractor, that's what we started working with him first, and that was mainly he started seeing the difference in the pain that he was experiencing there, and I said, hey, its origin is over back down in here into the lower back. So we started addressing that. So I'm going to share with you just a part of his adjustment. This was I would say, you know, a good experience for you so far.
Definitely.
This is going to be number 3 visit today, I believe, if I'm not mistaken.
Yep.
Let's have you go face down. Let's start the evaluation on you. And he noted to me and said that, hey, treatment's lasting a lot longer. So people that are definitely, and I could see this now with our athletes, people that invest in their health, it's so much easier working with them. Already, he's starting out. So one of the things as chiropractors we look for is imbalance in the legs. So when he lays down, I'm seeing like just a 1/4 inch difference in the leg length. And so we use that as a basis for what we're doing in our adjusting, just a 1/4 inch, so that's a lot less stress than when he first started. We talked about his posture, and we talked about the alignment in his neck, his mid-back, and his lower back. So let's test the lower back right here at the sacrum. I want you to raise this leg without bending the knee. Good, back down, other one. Back down, a little bit of restriction there, but big improvement from day one. So that's the sacrum area. I want you to cross this leg over this one for me. Perfect. We're going to open this SI joint up. We're going to adjust it with the drop piece. Keep it there for me. Breath in. Blow it out. Uncross the leg. What I want you to do is go ahead and raise the left leg for me as high as you can. A lot better, a lot stronger. Back down. Good. So I use the drop to help initiate the process into aligning that area. I also started with the instrument in moving and shifting this primary bone. It's called a sacrum, and there are 5 pair of spinal nerves that come out of here, part of the sacral plexus. And a good portion of this low back communicates to the leg, in part to do that kind of motion. So we're looking for that. And then you saw me on the ending part there, adjusting his left SI joint while he was taking that leg throughout the motion to help initiate and move that area a little bit more. That helps reinforce the adjustment. So you'll notice when you watch my videos, there are a series of different things that I do with patients differently. And that's just part of reading the patient, getting to know them, and how their bodies work. So, all right, we're going to start with a little bit of the traction here. I'm going to bring that up. I like to stretch the spine out, stretch the joints, the ligaments, tendons, low back, so you can feel a little pull. I'm bringing the height of the table up, and we're going to lower this, so he's going to get a little bit of a pull right there. Gentle traction, lower back. Is that too much on you, Ty?
Nope, good.
Good job. All right, and we're just going to go across the mid-back, or what we call the dorsal area, to get a little bit of stretch in that back, to get them a little more pain relief, back pain relief. You know, it's a great back treatment. Relief care, and then I start to approach the individual segments here of each of the vertebrae. Sometimes you can't just like jump in on people and start doing that kind of motion on them. It's just too intense. So when I go on each of the vertebrae, so I'm actually attaching or contacting the spinuses back here. Ty, is that too much when
No.
you feel that? Okay.
Good, actually.
You feel a little more compared to when I first started.
Yeah.
And what we have to do with this kind of traction or is be really careful. Some people aren't used to that. It's kind of like starting a new workout. You have to build up, build into it. And this is the most we've done with him so far. Okay, so we're gonna bring the table back down. Take a deep breath all the way in. Release it all the way out. Good. All right, bending the knees. Good, and you can see a little shift in the feet as I bring them up. So that sacrum is tipping a little bit. We're gonna bring it back this way. Breath. Release. A little bit better in there. So now we're gonna enforce that a little more with the instrument. And you can see the direction I'm holding at. That changes the function of that sacrum there, or it changes the movement of the sacrum. He'll notice it in how he moves. Do you feel the difference in your legs now, Ben?
Yeah.
As soon as I did that?
Yeah.
All right, place your right hand on your lower back. Switch hands. And we're checking the lower lumbar by doing, and you can see the difference significantly. Let's have you lay on this side, face me this way. So your leg went about a good inch and a quarter short when I had you do that test. So there's stress right at L4, bend this knee. There you go. Is this TMI for you?
Wow.
Breath in, blow it out. There you go. There it is. Good job. On your back for me, please. Feet on the table, knees bent. Breath in, release. Good. Breath in, and out. Good job. Good job?
Yeah.
All right. I do the full spine, full body adjusting, so I check the mid-back, or the neck, mid-back, low back. Then I go through the extremities as well. I feel that's a part of the service that patients here at the office deserve. And a lot of times they don't know that chiropractors even work with those type of areas. All right. Feet down. Good. This is the problem hip?
Yep.
Yep. Can you raise both your legs up at the same time without bending the knee? Back down. Good. Can you raise the right one up? Back down. And the left one. Back down. Are you getting some tightness in through here?
A little bit.
Okay, so the front stretches where you do that front lunge, start working on that. All right, let's have you sit up and face that direction for me. We're gonna check the shoulders. Good, I'm gonna adjust this shoulder. Beautiful. Yeah, checking the elbow and wrist. 26 carpal bones, or 26 bones in the hand. Obviously he uses his hands quite a bit. Feel pretty good there. All right, anything you want to share with the audience about your experience?
The range of motion that I've definitely gotten over the last couple of weeks is definitely beneficial. The first time it was definitely weird, trying to move after that. I was, body's not used to it, but after that I just started seeing the improvements and everything like that, and it's just, I can't thank you enough for sure.
Oh, you're welcome.
Yeah, thank you.
Absolutely. I'm your first chiropractor.
Yes.
So, when you're new to chiropractic or new, there's a lot, it's whatever you've heard out there, whatever you watched on TV or Hollywood. The other things is that, hey, this guy's in my personal space. And not a lot of practitioners have their hands all over you doing all this kind of work. But, if you give a few visits a try with your chiropractor and see the difference, the biggest thing is building that trust with that individual. And, you know, in explaining, you know, like, I don't talk like this with him every single visit that he comes in. We're talking about what's coming up, but helps you as a patient understand what's going on back here. Why is he looking at my feet?
Yeah.
So, you know, it gets pretty old when I do it all day like that. But anyways, I'm Dr. David Warwick of Warwick Chiropractic, and I want to thank you for watching. I'll see you soon.